Well, hello and welcome back to another Med Monday. I hope you had a great weekend. We're going to have a fabulous week this week, so let's get started. So, this week our medication is Metformin. It is an anti-diabetic and it's given orally. The mechanism of action is that it inhibits hepatic glucose production and it increases sensitivity of peripheral tissue to insulin. The half-life is 6 hours. Our peak time is 2 to 3 hours for intermediate release and 7 hours for extended release. Indications for this is type 2 diabetes. Contraindications, or why we won't be giving this medication, include DKA, metabolic acidosis, renal failure, and if we're going to be giving radiologic contrast to our patients. Side effects include fatigue and dizziness, headache, vertigo, tinnitus, hypoglycemia, and sometimes patients can develop a metallic taste. So, adverse reactions include uh, lactic acidosis, and that is a black box warning, so be aware of that. Thrombocytopenia, it potentiates digoxin, meaning it makes it stronger. And we want to make sure that we do not give radiologic contrast if patients are taking this. So typically, if they're going to have an MRI or a CT or even before surgery, we will hold the metformin and then they can go ahead and have their procedures or exams done. Nursing considerations include we're going to be monitoring for signs and symptoms of hypoglycemia. We want to remember that it potentiates several medications, digoxin, morphine, procainamide, and vancomycin. These are medications that we need to be watching for renal function and side effects. So it's very important to be aware of this. We also know that it increases hypoglycemia with calcium channel blockers, corticosteroids, estrogens, oral contraceptives, and diuretics, as well as beta blockers and phenytoin. We want to monitor CBC, our liver function panel, chemistry panels, and that will include our creatinine. So we will be able to see our kidney function. We want to monitor our hemoglobin A1C and B12. And again, we want to hold when the patient is NPO or nothing by mouth. Patient teaching includes, of course, as always, to take as prescribed. We want to monitor our patient's blood sugar. We want to teach them signs and symptoms of hypoglycemia. We want them to check with their pharmacist or physician before adding any herbal supplements and over-the-counter medications. We also encourage patients to use a medical alert identification bracelet or necklace. We want them to make sure that they take it with meals. Do not break, crush, or chew this medication. And for our patients, our female patients that are within reproductive age range, we want to make sure that they know that this could affect their contraceptives. So if you leave your answer in the comments for our weekly challenge and you are correct, you will be entered to win a $25 Amazon gift card. So our question this week is, our patient is to take metformin 850 milligrams PO daily. He has difficulty swallowing the tablets, so he's given metformin 500 milligrams per 5 mLs oral solution. How many mLs will he take daily? Don't forget to leave your answer in the comments. I hope you have a great week, and we'll see you next time.